Hello everyone, welcome to the PYQ series, and in this series I'll be posting videos on the detailed explanation of previous year question asked in various PG examinations such as NEET PG, INI-CET, FMGE. The quickest, easiest and surest way to complete any subject for any PG examination is to complete the PYQs, and more precisely I can say the previous year topics. So this is the theme of our PYQ series. So welcome to my channel Microbiology Simplified, and I'm your guide and mentor Dr. Amit Kumar Singh. So let's start with the video. Today's topic for discussion is bacterial meningitis, PYQ number 1. So let's start with the question. So the question is, a 1.5-year-old child came with history of fever, headache, neck rigidity and seizure. CSF examination showed low glucose, high protein and polymorphonuclear pleocytosis, and CSF culture showed growth of gram-negative pleomorphic bacilli. Okay, to answer the question, first see what is the information given in the question. So I'll mark it one by one. Okay, so first information is the age, 1.5-year-old child. Okay, first. Second information is the symptom of the patient: fever, headache, neck rigidity and seizure. Okay, and third is the CSF examination which showed low glucose, high protein and polymorphonuclear pleocytosis. Okay, so this is the third information. And the fourth is growth of gram-negative pleomorphic bacilli. So we'll go one by one. So first let's start with the symptom. So this fever, headache and neck rigidity and seizures, it indicates what is this? The symptoms is of which disease? It is of meningitis. Okay, the symptom belongs to meningitis. Instead of mentioning the symptom, they would have mentioned the signs such as Kernick sign or Brudzinski sign. So instead of this, they would have mentioned the sign also. Okay, so now the case is of meningitis. So definitely the investigation which we will do first of all is the CSF examination. And the CSF examination shows low glucose, high protein and polymorphonuclear pleocytosis. So to find out that what type of meningitis it is, so let's see the various CSF findings in various types of meningitis. So if you see first the pressure. So pressure in case of bacterial and tubercular. In case of bacterial and tubercular, if you see the pressure is increased. Okay. However, it is normal or slightly elevated in case of viral or fungal. So pressure will be increased in bacterial and tubercular. Okay. And also it is turbid in case of both bacterial and tubercular. So pressure and color. Pressure is increased and color, and the CSF is turbid in case of bacterial and tubercular. However, the pressure is normal and the CSF is clear in case of viral and fungal. WBC, if you'll see the count, that is pleocytosis in case of bacterial, although the WBC is increased in all type of meningitis, but it is markedly increased or markedly elevated, may reach up to 10,000 in case of bacterial meningitis. So it is markedly increased in case of bacterial meningitis, and it is mildly increased in case of fungal meningitis and moderately increased in case of tubercular and viral meningitis. So you can remember it like that. Okay, so in case of bacterial it may reach up to 10,000. However, it will reach up to 500 in case of tubercular and viral and up to 200 in case of fungal. WBC type, if you will see, so in case of bacterial, the predominant WBC is neutrophil. However, in case of rest of the three, that is tubercular, viral and fungal, it is lymphocytes. But there are certain exceptions, so you should know that in case of bacteria, lymphocytes may be predominant in certain types of meningitis caused by gram-negative bacillary agents or caused by listeria or caused by Borrelia in case of Lyme's disease. Okay, in case of Lyme's disease. Okay, and it may be mononuclear in case of neurosyphilis. Okay, so it may be lymphocytic in case of gram-negative bacillary meningitis, in case of Listeria monocytogenes meningitis, or in case of Lyme's disease, and it may be mononuclear in case of neurosyphilis. Okay, in case of viral meningitis, if you see, although it is lymphocytic, but initial for 6 to around 48 hours of infection, it is usually neutrophilic and it later shift to lymphocytic. This shift may delay for up to a week in case of meningitis caused by West Nile virus. Okay, so remember this, in case of West Nile virus meningitis, the shift from neutrophilic to lymphocytic pleocytosis may take up to a week. Okay, and in tuberculosis, the predominant type is lymphocytic, but sometime in case of early infection, again we may see a mixed type of pleocytosis, that is mixture of neutrophilic plus lymphocytic pleocytosis. Okay, protein, if you'll see, again protein is also increased in all the four types of meningitis as the number of WBC, but this time the protein is greatly elevated in case of tubercular meningitis, and it is normal to mild elevation in case of viral meningitis. So in viral meningitis, it is the least increased and it is greatly increased in case of tubercular meningitis. However, it is elevated in both bacterial and fungal, but it may be normal in case of viral meningitis. Okay, and the glucose, if you see, the CSF is to serum glucose or blood glucose level. If you'll see, it is normal in case of viral meningitis, however it is low in rest of the three. Okay, but in case of viral meningitis, we may see low CSF glucose in case of meningitis caused by lymphocytic choriomeningitis virus and mumps virus. Okay, and mumps virus, lymphocytic chorio meningitis virus and mumps virus, we may see a low glucose CSF glucose level. Okay, and also the lactates are elevated in case of bacterial and tubercular, like the pressure is also elevated in these two, and lactate is also elevated in these two, and also the CSF is turbid in these two only. So now in the question, if it is mentioned that the CSF should low glucose, high protein and polymorphonuclear nucleocytosis. So on the basis of whatever I told you, what type of meningitis it is? It is a case of bacterial meningitis. Okay, so this is a case of bacterial meningitis. So now to know that what is the causative agent, because then only we'll come to know about what is true about the organism. So we need to know the common bacterial causes of meningitis in different age group. So the first information given about the age of the child is around 1.5 year old. So we need to know what are the bacterial agent causing meningitis in this age group. Okay, so for that, there is another table. So if you see here, for the age group less than 1 month, the common agent, these two are the commonest agent, that is Streptococcus agalacti, that is group B Streptococcus, and Escherichia coli. Okay, so these two are common in neonates, that is less than 28 days of age. However, Streptococcus agalacti may also cause meningitis in children up to 3 months of age. Apart from this, if you see, Listeria monocytogenes and Klebsiella can also cause meningitis in children less than 1 month of age. One more important point I wanted to mention here, that Listeria monocytogenes is known to cause infection mainly in neonates, pregnant women, elderly. Okay, and it can cause infection in immunocompromised individual at all age. Okay, so if the individual is immunocompromised, then Listeria monocytogenes may be the causative organism irrespective of the age. Okay, and Then from 1 month to 23 months, that is up to 2 years, again this Streptococcus electi and Escherichia coli may cause the infection. But now here in the scene comes this, apart from these two, is Haemophilus influenza. Haemophilus influenza is known to cause meningitis in children younger than 6 years of age. However, the peak is between 6 to 12 months of age. Okay, and the type, the capsular type which causes most of the infection is type B. Okay, and apart from this, now there are two more agents which is introduced here is Streptococcus pneumoniae and Neisseria meningitidis. Streptococcus pneumoniae causes infection in all age groups and highest in elderly. Okay. Now from 2 to 50 years of age, again these two agents will remain the causative agent, that is Streptococcus pneumoniae and Neisseria meningitidis, and also for more than 50 years of age, these two agents are the causative agents. But as I told you that Listeria causes infection in neonates, pregnant women and elderly. So now this Listeria monocytogenes is a causative agent in age group more than 50 and also in immunocompromised individuals. Apart from this, gram-negative bacilli such as Klebsiella, Escherichia coli, Serratia, Marsis, and Pseudomonas salmonella species can also cause infection in elderly and immunocompromised individuals. One more point I want to add here, that Neisseria meningitidis causes endemic disease in children and young adolescents and epidemic in older children and young adults. So in children and young adults, it causes endemic disease and epidemic disease in older children and young adults. Okay, so this is about the causative agent. So if you see the list here, the age of the patient, our patient is 1.5 year, that is he belongs to this age group. Okay, he belongs to this age group. So what could be the causative organism? So all of these are bacterial agents. So Streptococcus pneumoniae, Neisseria meningitidis, H. influenzae, Escherichia coli, Streptococcus electi, anyone may cause infection. So how to point out that what is the commonest agent? So on the basis of the information whatever I told you, what it seems that the CSF culture, the fourth information, showed growth of gram-negative pleomorphic bacilli. So among these 5 agents which I told you, Streptococcus agalacti is a gram positive cocci. Escherichia coli is gram negative bacilli. This is gram negative bacilli. This is again gram positive cocci, and this is gram negative cocci. So there are only 2 gram negative bacilli. However, among these two, there is only 1 gram negative pleomorphic bacilli, and what it is Hemophilus influenza. Escherichia coli is not pleomorphic, but the pleomorphism is characteristic of Hemophilus species, not only influenza, all other species of Hemophilus. Hemophilus also shows pleomorphism. Okay, so pleomorphism is characteristic of Hemophilus. So now on the basis of this list, now we know our agent is Hemophilus influenza. So now see the options. So now as we know the organism, see the options. First is Bacitracin sensitivity. Okay. Okay, so the first option, Bacitracin sensitivity. So what it is? Bacitracin sensitivity test is basically a differential test. It's basically a differential test. So what it differentiates? It differentiates between group A Streptococcus and non-group A Streptococcus. That means any other Streptococcus apart from group A. And what is that group A Streptococcus? Group A is Streptococcus pyogenes. Okay, and how it do? It do by utilizing Bacitracin antibiotic disc containing 0.04 international unit of Bacitracin. So this group A Streptococcus is what it is? It is sensitive. It is sensitive to Bacitracin. So how it will be determined? When we will do a non culture of the Streptococcus to determine whether it is a group A or non-group A, if any zone is formed around the colony, formed around the disc. Suppose if this petri plate of 5% blood agar, and if this bacitracin disc is present in the center, and if you see any zone around this, okay, and then up, and then there is a growth, so this indicates sensitivity. So this indicates sensitivity, and thus it indicates that the organism is group A Streptococcus or Streptococcus pyogenes. And if there is no zone, that means growth starts right from the next to the disc, so it indicates non-group A. Okay, so this bacitracin sensitivity test is basically to distinguish between group A and non-group A, and not used for Hemophilus influenza. So this option is not correct. Okay, the next option is alpha hemolysis on sheep blood agar. So what I want to tell you, that Hemophilus influenza does not cause hemolysis. Okay, and why it does not cause hemolysis? Because it cannot grow on blood agar. Though it can grow on blood agar, but not on blood agar which is not either containing any growth of Staphylococcus aureus, which will lyse the blood RBC present in the blood agar and releases the factor necessary for the growth of Hemophilus influenza, or if that agar contains the separate disc containing the necessary factors needed for the growth. So this alpha hemolysis on blood agar is not the characteristic of Hemophilus influenza. So it is characteristic of which organism? This is characteristic of pneumococcus. And apart from pneumococcus, viridans streptococcus. Okay, pneumococcus and viridans streptococcus shows alpha hemolysis due to incomplete hemolysis. And how it will look? It will look greenish discoloration of medium. Okay, where next to colony. Okay, greenish discoloration of medium next to the colony. Okay, so this alpha hemolysis is not feature of Hemophilus influenza. Why? First reason I told you. Second reason, it cannot be grown on blood agar, because what it needs, I said, certain accessory factor. And what are those? Factor 5 and factor 10. Factor 5 is NAD and factor 10 is hemine. So these factors are necessary for the growth of Hemophilus influenzae. Okay, so that is why alpha hemolysis on sheep blood agar, again this is option is not correct. Now the third option is satellitism around Staph aureus colony. So in the previous option I told you that it may grow on blood agar if it is cultured along with Staph aureus. So what Staph aureus will do? So this satellitism is basically characteristic of Hemophilus influenzae. Okay, this is characteristic of Hemophilus influenzae. Okay, and what it is, we will take a blood agar plate. Okay, and what we'll do, we will streak a culture of Staph aureus, and perpendicular to it we will streak the Hemophilus colony, Hemophilus influenza. So what will happen? As we know that Staph aureus has the capability to hemolyze the blood, or basically the RBC, so it will release the accessory factors present in the RBC, that is factor 5 and factor 10, into the medium, which will help in the growth of Hemophilus influenza. So the colonies next to the streak line of Staphylococcus aureus will be bigger, and the colonies which are farther are smaller. So large well developed colony next to the streak line is because of the release of factors 5 and factor 10 around the growth of Staphylococcus aureus due to hemolysis, whereas the farther away colony will not get that much amount of factor 5 and factor 10, and the colonies will be smaller. So smaller, farther away, larger, nearer to the streak line of Staphylococcus aureus. Okay, so this is the correct option. That is, satellitism around Staph aureus colony is characteristic feature of Hemophilus influenza. Okay, because of its need of factor 5 and factor 10 for its growth. Okay, we'll also see the fourth option, that is the non-lactose fermenting colony of McConkey agar. One more thing I wanted to add it here, that although Hemophilus influenza is non-lactose fermenter, so it is correct that it is a non-lactose fermenting, but again, it cannot grow on McConkey agar. It cannot grow on McConkey agar. Why? Because what it need? It will need factor 5 and factor 10. And where it will be present? It will be present inside blood. So how to release this factor from the blood? We cannot always do satellitism. So any other way? Yes. Instead of using blood agar, what we can do, we can heat the blood agar at 72 degrees Celsius for 20 minutes, or rather by heating the blood directly, we can add the blood into nutrient agar at 72 degrees Celsius and keep it for 20 minutes. So what it will form? It will form chocolate agar, and this is the enriched medium which is used for growing Hemophilus influenza. Okay, so McConkey agar cannot be used for culture of Hemophilus influenza. So although it is non-lactose fermenter, it cannot grow on McConkey agar. So this option is also incorrect. So the correct answer is to this question is satellitism around Staph aureus colonies. Okay. So there are certain key points which you should know about Hemophilus influenza. I'll go through it. So as I told you, it is a gram-negative pleomorphic bacilli. Apart from this, it may be capsulated and it may be non-capsulated. So both type of strains are present, both capsulated and non-capsulated. Okay, and as far as fermentation is concerned, it can ferment glucose and xylose, but cannot ferment lactose, sucrose, and mannitol. Okay, and catalase and oxidase. Remember this: catalase and oxidase is positive for Hemophilus influenza. I have seen one question asked in this. Okay, catalase and oxidase positive is Hemophilus influenza 2. Not only Hemophilus influenza, there are other bacteria which is catalase and oxidase positive. It is one of them. Okay, you can kindly ignore this spelling mistake. And the major antigenic structure present in Hemophilus influenza is what it is, and is the basis of classification of Hemophilus influenza. It is capsular polysaccharide. Okay, capsular polysaccharide. And this capsular polysaccharide, on the basis of this, it is divided into 6 types, A to F. Okay, 6 types, A to F. And the most virulent form or the most infective form which causes invasive infection is type B. Okay, and there is a characteristic difference between the type B, so not type A, type B, this type B Hemophilus influenza and the rest of the other type. The type B capsule contains pentose sugar, that is ribose and erythritol, instead of hexose and hexosamines present in other types, okay, other capsular types. So type B capsular type contains ribose and ribitol. So the antigen is polyribosyl ribitol phosphate. Okay, polyribosyl ribitol phosphate. This P stands for polyribosyl, this is for ribitol, and this is for phosphate. So this is the antigen present in the type B capsule. Okay, and the non-capsulated strains are called as non-typable strains. Non-capsulated are known as non-typable strains. And the cell wall, another difference between the rest of the gram-negative organism, the cell wall consists of lipo-oligosaccharide instead of normally what it is present, lipopolysaccharide. So it contains lipo-oligosaccharide. Which other bacteria contain lipo-oligosaccharide? So you should know this name because in examination it may be asked. So Neisseria, Moraxella and Bordetella. Okay, Neisseria, Moraxella and Bordetella contains lipo-oligosaccharide instead of LPS. And what is difference between lipopolysaccharide and lipo-oligosaccharide? That this lacks what? The O antigen. Okay, this lipo-oligosaccharide lacks O antigen. Okay, and also the capsulated strain, the most common is HIB, that is HIB, Hemophilus influenza type B. It causes mostly the invasive infections. And what are those? These are meningitis, epiglottitis, cellulitis and primary pneumonia. Okay, and this non-typable strains mostly cause non-invasive infections. Okay, so this non-typable, that means non-capsulated strains causes non-invasive infections such as otitis media, sinusitis, exacerbation of COPD and secondary bronchopneumonia. So remember, this non-capsulated Hemophilus influenza is responsible for most of the exacerbations of COPD. Okay, and apart from that, otitis media, it is second most common cause of otitis media. Second most common cause of otitis media. Okay, and the selective media which is used for growing is Levinthal's media. Okay, Levinthal's medium. So Levinthal's medium is the selective medium used for growing Hemophilus influenza. And the drug of choice for meningitis, what it is? Cephalosporin. What is that? Ceftriaxone or cefotaxime. And for respiratory infection, earlier it was ampicillin, but due to development of resistance, now it is amoxicillin, clavulanic acid, known as amoxiclav, or we can also use clarithromycin. And for the prevention of the infection, vaccination is available, and as HIB is the most virulent and most prevalent, then that's why this conjugate vaccine is used, that which in which we will conjugate this HIB PRP vaccine with DPT vaccine. Okay, and we will give it on 6, 10 and 14 weeks. Okay, so this is about this Hemophilus influenza causing meningitis. I hope I was able to explain the topic, and I'm very sure that this topic and this discussion is going to be helpful for your examination. So all the best. We'll see you in the next PYQ.